So you've just signed up for Medicare Part A and Part B, or you've just gotten your Medicare Part A or Part B cards in the mail. So let's answer today, what's next? My name is Ed Weir. I'm a retired district manager in the Social Security Administration. I've helped hundreds of thousands of people out with all things Social Security, Medicare, the Affordable Care Act now, survivor benefits, disability benefits, early retirement, late retirement, delayed retirement, the Medicare Part A, Part B, Part C, Part D. So there's not many people in the country that have my background, expertise, and experience, particularly on the inside. So if you're looking for help, now that you've got your cards, give me a call and we'll walk through the entire process. And of course, use my background with Social Security to make sure you're getting all the benefits you're entitled to. All right, so you've got your cards. You have what we call original Medicare, just Part A and Part B. Let's go over today what exactly you have in your hand or you're about to get. All right, so Part A is the hospital. And for most people, it's free. If you didn't work and didn't pay FICA taxes for a certain amount of years, then you might be paying for your Part A. But for the most part, let's go with most people receive Part A free. Again, this is the hospital. There are some gaps. There are essentially 6 gaps in original Medicare, 3 in Part A and 3 in Part B. So you have some options to fill those gaps, and that's what we're going to talk about today. But let's find out what those gaps are. First of all, Part A, there is a deductible. In 2023, that deductible is $1,600 a benefit period. Okay, this gets a little complicated, but it's not an annual deductible where you pay the $1,600 one time a year and you're done. It could be multiple times a year. So if you go into the hospital and you're actually admitted to the hospital, then you'll have to pay $1,600 before Medicare will cover anything. So that's the deductible. If you go out of the hospital, you're discharged and you're good and you don't return to the hospital for 60 days, then you don't have that deductible. But after that 60-day period, if you go back to the hospital again, you'll have to pay another $1,600 deductible. So it could be multiple times per year. Okay. So that's the first gap in original Medicare that you have to consider once you make your choices on whether you're going to add some type of supplement, which we'll talk about here in a bit. All right. So that's the first gap. The second gap is I'm going to put up a chart here and we'll go down through the list. The second gap, as you can see, is when you actually go into the hospital. So from days 61 to 90, Medicare covers all eligible expenses after the patient pays their per day copayment. And in 2023, that per day copayment is $400 a day. So that's from 61 to days 90. So again, for the first 60 days, you don't pay anything except for that deductible. From 61 to 90, you have to pay $400 a day. Days 91 through 150, you'll have to pay $800 copay. So that's Part A of hospitals. In terms of, so this is the hospital deductible and the copay. So that's gap 1, gap 2. And the third gap is skilled nursing confinement. So that's following an inpatient hospital stay of at least 3 days. And then you go into a skilled nursing facility to kind of recuperate from whatever procedure you had done in the hospital. So Medicare pays all eligible expenses for the first 20 days, then all eligible expenses for days 21 through 100 after patient pays a per day copayment. And that after the first 20 days is $200. So that is the third major gap. All right, so that's the gaps for Part A. Now let's talk about the gaps for Part B. Part B gap is first one is there is a deductible. Again, just like Part A. The deductible for 2023 is $226 And that's a one time a year. So you just pay the $226 one time a year and you're done. Okay. The other gap is the 20% coinsurance. So if you go to a hospital and the hospital is taken care of by Part A, but the doctor, the surgeon, is taken care of by Part B. You do an outpatient surgery or something like that. Let's say it costs $100,000, then Medicare will pick up 80% of that. So they will pay $80,000 under Part B, but you will be obligated for the remainder, the 20%. So you'll have to come out with $20,000 out of your pocket. Okay. The third gap is what's called excess charges. Most doctors in the country take assignment, which basically means they accept Medicare and they accept Medicare rates. But there are a few doctors, not many, 2, 3, 4% or so. The number varies every year, but not many. Don't take assignment and they charge essentially their own rates, but Medicare limits that to the Medicare rates plus essentially 15%. And this is called what's excess charges. And you can find out whether your doctor, takes assignment and, charges the extra 15%. And it gets kind of complicated. It's not technically 15% because there's like a 5% charge there. Yeah. But most doctors in the country accept Medicare, but there's a few doctors and facilities that don't, and those will charge the excess charges. Okay, so that is your first option. Stay with original Medicare Part A, Part B, and go on with your life. If you have other health insurance, federal employee health benefits, if you have TRICARE for life, if some other type of health insurance to cover those gaps, then fine, it's a beautiful thing. If you got a few $100,000 laying around that that you can pay that 20% Part B premium or the co-insurance with, then you're good. Stay with Part A, Part B. For those that don't have a few $100,000 laying around, there are a couple of options. And the two options are option A, which is a Medicare supplement plan, also called a Medigap plan, and option B, which is the Medicare Advantage plans. Okay, so let's get into the difference between a Medigap or Medicare supplement plan and a Medicare Advantage plan. The Medicare supplement plans, those are kind of like traditional insurance. So you keep your Part A, keep your Part B, and then you buy a supplement plan from a particular company, a private company. There's United Healthcare and Aetna, and Mutual of Omaha, many companies out there in your particular area. And you buy one of those plans and there's a premium. The premiums are about $125 on average throughout the country. It depends on your particular state and area, but about $125. And then it covers a lot of the gaps. And it depends what plan you get. The most popular right now are Plan G and Plan N. There was another plan called F, but those are for people, they're essentially no longer offering those anymore unless you're essentially way over 65. You had to be 65 before 2020. So Plan G and Plan N, and I'll have another video up there to kind of go through the differences between a Plan G and a Plan N. But for the most part, they cover the, they don't cover the Part B deductible. They cover the Part A deductible, the $1,600. They cover that the big one is the 20% co-insurance on Part B. They cover that. One of them, the Part G, does cover excess charges. Plan N does not cover excess charges, but the Medicare supplement plan is usually Plan N is cheaper because it's not a guaranteed issue. But again, watch my other video on the comparison between Plan G and Plan N and a little bit more detail in it. People often ask, what if I had to choose for myself and my family, what would I choose? Well, there is no perfect plan for everybody. It really depends on your particular situation. I've got another video up there where I say, well, In order to get the most bang for your buck, I would probably choose a plan N if you could afford the monthly premium. If you can't afford the monthly premium, then Medicare Advantage might be the way to go. So it's a really individualized decision on your particular health, your particular budget. So give us a call, and we can help you and walk you through all of the variables and the decision points that you need to think about when you decide to go down option one or option two, option A or option B. So the Medicare Advantage plans, most of those, particularly the ones we usually offer to people that contact us, are zero premium. And first question is, okay, why would I take a Medicare supplement plan when I have to pay, $100, $125 a month for it, and not take a Medicare Advantage plan with zero premium? Well, the Medicare supplement plan, a lot of advantages to them. You don't have to get referrals. You don't have to get permission from an insurance company to do X, Y, or Z procedure. As long as Medicare covers it, then you're good. So there's a lot more freedom there. You can see any doctor. There's no networks or anything like that. Again, a Medicare Advantage plan, zero premium, but you do have some limitations. And one of the limitations is, um, in order to save the most money, it's an HMO. So you have to see whatever company you pick, you have to make sure you go to their in-network doctors. You can go out, but then the price is going to be quite a bit more. So when you pick a Medicare Advantage, first thing you do is you make sure you pick a Medicare Advantage plan that covers the doctors you want to go to and the prescriptions. Medicare Advantage plans, most of them have prescription drug coverage bundled in with the Medicare Advantage plan. Medicare supplement plans do not have the Part D in there, so you have to buy a separate Part D plan as well. All right, so how do you know what's best for you? Well, you can give us a call. Do a little research, go on to Medicare.gov. How do you sign up? Well, there's probably dozens of different plans in your area: Medicare supplement plans, Medicare Advantage plans. You can request the help of an agent like myself. We are brokers here, and we've contracted with most of the major carriers in the country. And so we look for a plan in your particular area. If it's a Medicare supplement plan, we're just looking for the best price, because they're all the same. Doesn't matter what company it is if you're going to pick G, essentially all the companies are the same. They offer the same type of benefits. Medicare Advantage plan, again, we ask you what doctors you want to continue to see, your prescriptions, and then out of the dozens or so probably in your area, we give you a couple of recommendations. Say, well, this one looks like it covers all your doctors, covers your prescriptions, and it's the best price in terms of maximum out of pocket and your prescription drug costs and all the rest of it. And what do we charge for that? Well, we don't charge anything. All agents and brokers in the country get paid directly from the insurance companies. And you'll say, well, why don't I just go directly to an insurance company? Well, it's the same exact price, whether it's a Medicare supplement, a Medicare Advantage plan, it's exactly the same. If you go directly to the company, then if you have any problems, you call the company. If you go through a broker like ourselves, if you have any issues, you call the company, but you also have a fallback position. You contact us, and then we can help you navigate the bureaucracy. And one of the benefits of contacting me personally is that my decades of inside Social Security experience, I can help you, your family, relatives with all things Social Security. So if you've got any relatives looking to early retirement or delayed retirement, or want to sign up for Medicare or disability, then you've got an extra resource, free resource at any time to refer them to us, and we can definitely help them through any of the bureaucracy that they need help with. So once you contact an agent or a broker, what happens then? Again, you have to figure out what you want to go with. You want to go with a Medicare supplement or Medicare Advantage plan. And then the individual can give you your recommendations on Medicare supplement, which one is the best one in your particular area, when can you enroll, can you enroll, if you decide you want to go with the zero premium Medicare Advantage plan, again, go through the doctors, go through the prescriptions. And it's important to make sure that you ever contact, it's kind of the old Henry Ford thing, that you can have any color car you want as long as it's black. If you contact, Acme broker, and that Acme broker is only contracted with Acme Medicare company, then guess what Medicare plan you're going to get? You're going to get Acme Medicare. So it's important that whoever you talk to is contracted with many or most of the Medicare insurance companies in your particular area, so they can offer you the best of all of them, and the choice will be left up to you. All right, so that's one of the reasons when you call a Medicare insurance agent under the new Medicare guidelines, they have to read a little thing that we do not offer every plan available in your area, every offering. So everybody has to read this little blurb about, we do not offer every plan in your area, and all calls are being recorded. Medicare the government is trying to shut down some of these kind of shady Medicare companies, particularly the ones you see on TV. Those are usually not necessarily selling Medicare, they're more selling leads. So they get some famous person and, they make all kinds of different offers and, we'll give you the world. You call them up, they get all your information and they forward it. They sell that information to insurance agents or brokers, a company call center somewhere, and then they harass you for the next 20 years. So there's that. So you can, again, give us a call and we can walk you through the entire process. If you have a local agent or broker that in your area that you trust, that and one of the things to be careful of, there's a lot of people out there that say they are Social Security experts. There's a company that offers a 2-day seminar on Social Security, and then they print up a cute little certificate that says you are now a Social Security expert. I spent a few decades. I ran the third busiest Social Security office in the country. I've helped hundreds of thousands of people out with Social Security, Medicare, Medicaid. I worked at the Department of Welfare before I worked for Social Security. I was a sergeant in the Marine Corps before all of that, so I'm familiar with veterans benefits. So if you're looking for someone with a government bureaucratic experience, that inside knowledge, insider tips, tricks, and secrets, then absolutely give me a call, and I can walk you through the entire process and make sure you don't make any mistakes. This is your finances. This is your health. It's very important that you make the right decision the first time, because the government is many things, but it's not always forgiving. And so, I didn't know. Well, that's one of the biggest responses I get. Well, I didn't know I had to do this, that, or the other. The government doesn't always allow that as an excuse to get around, circumvent the law. So it's important that you do things the right way from the beginning, so there are no issues. The government also takes a long time coming back around. So you might be good for a few months or a few years, but then the government comes back and, oh yeah, we should have never done X, Y, or Z. So give us all this money back. So that's one of the unfortunate parts. So let's make sure that's not you. Give us a call so we can make sure you're doing the right thing from day one. And as always, have a beautiful day.